Hey everyone, and welcome back to the channel. Today, we're re-diving deep into a topic that affects millions of people worldwide but often goes unnoticed until it's serious: vascular disorders. You might think of your body's circulation system like a massive, intricate highway network. Your arteries are the main roads carrying oxygen-rich blood from your heart to every part of your body, and your veins are the routes that bring it all back. When there are traffic jams, roadblocks, or damage to these highways, that's when vascular disorders occur. It's a broad term that covers any condition affecting this network of blood vessels. So, what causes these traffic jams? One of the most common culprits is atherosclerosis. You've probably heard of it as hardening of the arteries. Imagine plaque, which is a sticky mix of fat, cholesterol, and other substances, building up on the inner walls of your arteries. Over time, this buildup can narrow the arteries, making it harder for blood to flow through. Think of it like a pipe slowly getting clogged. This can lead to serious problems, including heart attacks and strokes. Another big player is high blood pressure, or hypertension. When your blood pushes against the artery walls with too much force, it can damage them, making them weaker and more prone to problems. Let's talk about some specific types of vascular disorders. First up is peripheral artery disease, or PAD. This happens when the arteries that supply blood to your limbs, usually your legs, become narrowed. The most common symptom is a cramping pain in your legs when you walk, which goes away when you rest. It's your muscles telling you they're not getting enough oxygen. If left untreated, PAD can lead to serious complications, including sores that don't heal and even the risk of amputation. So, that leg pain you might be brushing off. It could be a sign to see a doctor. Then there are issues with the veins. Varicose veins are a common one. These are those swollen, twisted veins you can see under the skin, usually in the legs. They happen when the tiny valves inside your veins, which are supposed to keep blood flowing toward the heart, become weak or damaged. This allows blood to flow backward and pool in the veins, causing them to stretch and bulge. While often seen as a cosmetic issue, they can cause aching, pain, and a feeling of heaviness in the legs. A more serious vein issue is deep vein thrombosis, or DVT. This is when a blood clot forms in a deep vein, again, usually in the legs. The real danger with DVT is that a piece of the clot can break off, travel through the bloodstream, and get stuck in the lungs, causing a life-threatening condition called a pulmonary embolism. Now, let's discuss aneurysms. An aneurysm is a bulge or a ballooning in the wall of a blood vessel. They can happen in any artery, but they're most common in the aorta, the main artery that runs from your heart through your chest and abdomen. The problem with aneurysms is that they can grow silently over time without any symptoms. If they get too big, they can rupture or burst, which can cause massive internal bleeding and is often fatal. That's why screening for aneurysms is so important, especially for people with a family history or other risk factors like smoking. So, what can we do about all this? The good news is, lifestyle changes are your first line of defense. Eating a heart-healthy diet, low in saturated fats and sodium, getting regular physical activity, maintaining a healthy weight, and most importantly, not smoking. These are all powerful tools to keep your blood vessels healthy. Quitting smoking is probably the single best thing you can do for your vascular health. If you have conditions like high blood pressure, high cholesterol, or diabetes, managing them effectively with the help of your doctor is crucial. This might involve medication in addition to lifestyle changes. For more advanced vascular disease, there are various treatments available. From medications that help prevent clots or lower blood pressure, to minimally invasive procedures like angioplasty and stenting, where a tiny balloon is used to open a blocked artery and a small mesh tube is placed to keep it open. In more severe cases, surgery might be necessary to bypass or repair a damaged blood vessel. The key takeaway is to listen to your body and be proactive. Don't ignore symptoms like leg pain when you walk, unexplained swelling, or sores that won't heal. Talk to your doctor about your risk factors. Early detection and management are everything when it comes to keeping your body's highway system running smoothly for years to come. Thanks for watching, and if you found this video helpful, please give it a thumbs up and subscribe for more health content. See you next time.